changing gears now, and we're going to move, we said in our agenda, we're going to move out of the oncology setting and into the world of integrative care, naturopathic oncology, rehabilitative medicine, and other services that can assist patients going through treatment and recovering from treatment. And I want to be really careful with this because I know there's a lot of sensitivity around, did I do something that brought this disease on? I shared that I felt that way myself. This session, please, this is the footnote. This is not meant to make anybody feel bad about anything that you do in your life. This is meant to be an empowering time where if you haven't been able to find a provider to talk about these things with, now they are here. And there is a world of information about what can really make a difference. I'm proud to share that I have been a patient with Dr. James, and she has been an enormous help to me. So listen with open ears. We know it's not maybe something that everybody here will want to go pursue, but there are some really great things to learn. Dr. James is going to speak for a half an hour probably. She's got a lot to cover. And then we are going to go into our panel discussion, and we'll take questions there. So please save your questions if you can until the panel discussion, unless there's a burning question. And I will turn it over to Dr. James.
Good afternoon. You guys have now had some lunch, so hopefully, even though it's post-lunch, you'll be a little more awake. I want to say, first of all, a deep, heartfelt thanks to Linda and the Komen Foundation for putting on this beautifully crafted program. This morning has been packed with science, packed with research, packed with a lot of really good information. This afternoon, like Linda said, we are going to be switching gears a little bit. I'm not too far away from the science, not too far away from the conventional oncology standpoint, but I do think I have a slightly different perspective to add. So again, thank you for giving me this opportunity. I want to ask one question right off the bat. How many of you have used something that would fall into the category of complementary and alternative medicine going through your cancer journey? That's a pretty big number. Out of this room, that's a pretty big number. Excellent. So I think what happens when you're diagnosed with cancer is you start looking at all of your options, right? And particularly when your cancer becomes metastatic, you look beyond your oncologist's office into anything else that you can take a look at on the internet, through friends, through other providers. I think there's a lot of wisdom in that. I inherently believe that once you have cancer, you do need to throw everything at it that you can. However, there are ways to go about adding integrative medicine into your program with some forethought. So that's what I'm going to try and talk to you guys about today. The intent of integrative medicine, so I'm using the term integrative as not shunning conventional medicine at all, not being alternative to conventional medicine, but rather working with conventional medicine. And the intent of integrative medicine is to support healing and provide an opportunity for thrivership. That's the term I like to use, not just survivorship, but thrivership. I want you to feel good regardless of what treatments you're going through or the stage of your cancer or any of those other factors. I believe that we can work with metastatic breast cancer as a chronic disease, as the chronic disease that it is, and that you can feel well in this process. So what is integrative medicine for cancer? It's a scientifically based approach, holistic approach that treats the whole person. Number one, I was trained as a naturopathic physician. I treat patients in a very holistic way. I look at all systems. I look at body, mind, and spirit. We want to use the body's innate healing power to help heal from disease. There's an emphasis, though, on natural substances that promote healing, herbs, nutrients, using food, using other lifestyle measures, natural products to support that healing. These can be lots of different things, but it can also include body-mind medicine, physical therapies, homeopathy, and acupuncture. And we do recommend pharmaceutical drugs if necessary when needed. There certainly is a time and a place for everything. So I believe that integrative oncology is complementary to and supportive of conventional treatment for cancer. Just a couple statistics, 70% of cancer patients in Western Washington use some form of complementary medicine, and up to 60% of the complementary medicines that people are using is undocumented in patient records. And what I hear from patients all the time is, oh, I don't want to tell my oncologist because he's going to poo-poo whatever I'm trying to do. And I always say, look, let's make sure that what you're doing is not going to interfere with your conventional treatment, and let's make sure that we're working as a team, because transparency among your team members is paramount to you being able to be as well as you possibly can be. Patients are often at risk for interactions with the drugs they're on, the chemotherapy they're on, whatever it is, and sometimes different natural compounds can work against each other. So you really need to kind of talk to someone who can make some recommendations along those lines. What we want to do with integrative medicine for cancer is enhance the treatment that you're doing conventionally and decrease side effects so that you can actually do the treatment. We provide pre- and post-surgical support, focusing on making sure you're not taking a bunch of natural products that might increase the risk of bleeding going into a surgery, for example, and then coming out of surgery, giving you what you need to help you heal well. There are lots of things we can use natural products for to prevent chemotherapy-induced side effects like mucositis, nausea, insomnia, and etc. And also to try and protect against radiation-induced fatigue and skin changes. That's generally where we're at with regular conventional treatment. Post-treatment, we talk about all the diet and lifestyle things that we can do to help prevent secondary recurrence. Now I realize many of you are past the secondary recurrence place, right? But there's still a lot of pieces to this puzzle, and that's what I'm going to focus the rest of my talk on today. I always think of cancer diagnosis and treatment as a hurricane. Someone is diagnosed, you know the storm is coming. Our job in integrative oncology is to batten down the hatches, close up the house, nail some wood into the windows, and try and protect the house from the storm. And then when you're done with the storm, focus on rebuilding, right? Like I said before, metastatic breast cancer is a chronic disease. There's constantly a storm going on. So how do we balance treatment with recovery? That's what I think we can do in this notion of healing and thrivership. So what are we focusing on in integrative medicine for cancer? I believe that these aspects of cancer growth may alter cancer outcomes, modifying what I call the biochemical terrain, the metabolism of the environment around cancer cells. This metabolism includes inflammation, growth factors, direct cytotoxicity, angiogenesis, which is the building of blood vessels to a tumor, immune system support, and then targeted therapies. I have in my armamentarium a whole lot of natural compounds and strategies that can focus on these different areas. Now, each one of these areas would be a whole talk unto its own. So I've been asked today to just focus on one of those areas, and that area is inflammation. What I mean by this slide, though, I wanted to stick this in here. If we go back to my list of the pieces of metabolism that we can maybe address in an integrative oncology way, this is what I'm thinking about. It's not a perfect slide, but it shows you how complex the idea of cellular metabolism is, and this biochemical terrain, this environment that might be around a cancer cell. It has to do with growth factors and hormones and dietary and lifestyle influences, all of the above. And then all the little bits and pieces that were talked about this morning by all those fabulous researchers who were here. So mostly I just want you to understand it's a very, very complex issue. So inflammation is what I've been asked to talk about today in specific. So first of all, I want to give you a definition of inflammation. It's a term that's really sort of bantered about. in popular media and, sort of all over the place right now. And it's a very complex biological process, but it's necessary. You have to have inflammation. If you cut yourself, you need inflammation. You need inflammatory chemicals to come to that site of the cut to heal, right? So inflammation is part of what keeps us alive. But when it's out of control, it can really be problematic. It can be caused by external things, it can be caused by internal things, it can be caused by hormone and biochemical imbalance, degenerative processes, autoimmunity, stress. This is just a visual to give you an idea of what's actually happening there. Steps of the inflammatory response. There's a lot going on when you step on that splinter, right? But this is a natural process. Why do we care though? We care because in so many of our chronic diseases that we're dealing with in the Western world, particularly cancer, inflammation creates a sort of hotbed for this metabolic growth. Pulmonary diseases, neurological diseases, cardiovascular diseases, Alzheimer's, all of these diseases, these chronic diseases, have inflammation as part of their root cause. And here's just a list, lots and lots of different things are inflammatory. So why do we think it's important in cancer? Inflammation as a process really underlies cancer development, promotion, and angiogenesis. There's all this chemical signaling that happens at the cellular level. And when there are inflammatory chemicals, they call out other chemicals. They recruit, right? And so this recruitment works on healthy cells, but it can also work on cancer cells. And as we know from this morning, cancer cells, there are genetic components, there are lots of different components as to why they might be there, but at different times in a person's own individual body and individual cancer process, there are things to be recruited. So if inflammation is a problem from other places in the body, those chemical compounds, those recruiters, might be reaching out to cause whatever cancer you have there to grow and be promoted. Inflammation orchestrates this microenvironment around tumor cells. And cancer cells use, again, these inflammatory chemicals for invasion, migration, and metastasis. So this is another graphic. I think this is a really good graphic. It just gives you the idea of how many different aspects of inflammation actually play a role in tumor development. There's inflammation from the therapy. There's inflammation caused by diet and lifestyle, inflammation caused by infection, and then the tumor itself causes some inflammation. And so all of this can cause some instability in this biochemical terrain. So there's some inflammatory biochemicals that actually can be measured in the blood. These are some simple tests. They're generally relatively cheap too. That a trained physician can take a look at and give some insight into levels of inflammation or other growth factor issues. So the ones that are bolded here, this is my thing. The ones that are bolded here are ones that are relatively easy to measure. The other ones are generally mostly measured only in sort of research settings. So this is kind of the meat of the issue. How do we stop inflammation? There are various ways that we can stop inflammation. An anti-inflammatory diet, exercise and lifestyle changes, anti-inflammatory supplements, and of course, medications. So one thing I want to just say before I launch into all of these diet and lifestyle issues, as Linda so pleasantly brought up, I'm sure that many of you in the audience might feel like you've done all these things already and you still have metastatic cancer. I want to make the argument that it's still important to have a really good quality diet and to take all of these lifestyle issues seriously, because again, it goes back to healing and thrivership, right? So that's really where I'm coming from with this. So what do I mean by an anti-inflammatory diet? Mostly what I mean is that it's a whole foods diet and that it's balanced between carbohydrates, proteins, and fats. So what do I mean by a whole foods diet? A whole foods diet is food that you can imagine growing, right? You can imagine an apple on a tree, you can't imagine a Twinkie. Right? So Twinkie, not whole foods. The Mediterranean diet, that's something that's been very popular over the last 20 to 25 years. The Mediterranean diet is pretty much lots of whole foods, produce, good quality fats, lots of fish, small amounts of red meat. Low glycemic index foods, those are low carbohydrate foods. Blood sugar is another growth factor. And again, I'm sorry, but that's a whole nother talk about blood sugar and that being a growth factor for cancer. But generally, low glycemic index, low carbohydrate diet, not too many foods that are pure carbohydrate. So, bagels, breads, grains, all of those things. So there needs to really be a balance among your whole foods of protein, fats, and carbohydrate so that the carbohydrate doesn't raise your blood sugar, that the protein is good quality protein, and that the fat also is good quality fat, mostly plant fat. Greens drinks, a lot of people really like greens drinks. They're often a way to get more produce into your body in an easy way in the morning. Green tea has a lot of fantastic chemicals in it that have direct anti-cancer benefit, like DNA repair for healthy cells, for example. Green tea also doesn't have very much caffeine, so if you're cutting back on caffeine, that's a great option. Green tea is also supportive of the liver, and the liver has to be processing all of these medications that you may be on. And so sometimes you need to be cautious with something like green tea and conventional medications, but as a drink, you're not necessarily going to get that much interference. Limiting alcohol for sure. Alcohol is pretty much straight sugar. And I always hate to state this statistic, but it's true. Women technically really should only drink half as much as men. Men get away with 14 drinks a week. Women can only have 7, but women who have had breast cancer should really have no more than 3 drinks a week. And when you're thinking about alcohol, a drink really is that 4-ounce glass of wine. It's not the great big glass of wine you're going to get at Purple, right? So you need to be honest about the amount of alcohol. 10 minutes. Okay, great. The other pieces to stopping inflammation with diet that I think are important, that I think about as a naturopathic physician, are things like improving your digestion and elimination, identifying food sensitivities, and then looking at how different things might be affecting hormones, neurotransmitters, and blood sugar. So again, I'm looking at my patients in a very holistic way. Exercise is the next big piece for stopping inflammation. It is the #1 way to prevent secondary recurrence of breast cancer. In metastatic breast cancer, the research tells us that there is significant improvement in function, bone density, and quality of life when you do exercise. And this morning I heard Dr. Janice Kim over in the bone metastasis breakout say that it has been studied. Women actually improve their bone mineral density with weight-bearing exercise while they're going through radiation treatment. So even though you may be really tired while you're going through radiation treatment, still doing some movement, some weight resistance training, anything like that, Pilates, that's really going to help in the long run and help you feel good and improve mood. A lack of cardiovascular exercise is really well documented in terms of risks for other things. And a lack of weight-bearing and resistance training exercise, that's also well documented in terms of increasing your risk for osteoporosis. Really, when it comes to exercise, you need to use it or lose it. But I find that patients often struggle with the diet piece. Because it is hard to kind of eat well all the time. And so generally I tell patients 80-20. 80% of the time eat really well, eat whole foods, eat an anti-inflammatory diet, and 20% of the time eat whatever the heck you want, but be honest about the 20%. Because otherwise you just can't get through, right? So have the piece of birthday cake at your granddaughter's birthday, but don't have the piece of birthday cake every day, right? So, and exercise though, I think exercise is an extremely important piece for healing, for thrivership, for quality of life. and for getting through treatment. I think, and Dr. Zucker will be able to speak about this a little more in our panel, but exercise really is key. I think it helps patients get through treatment. I think it also, obviously can help recover when your active treatment is over. Weight, hormones, neurotransmitters, sleep and stress management, all of those pieces can also be addressed with exercise. And I realize that many people don't have a lot of energy or don't have a lot of mobility, but I believe that there are ways to still be able to move gently, carefully, and appropriately. A few notes about supplements. The struggle that I have as a scientist in naturopathic oncology is that we don't have the kind of robust data that I would really like to see on natural products. We have some data, but we don't have phase 3 randomized controlled clinical trials on, drug X that costs $15,000 a month. We don't have that. I hope to see that as a research effort in my lifetime. But what we know about the natural compounds that we use is that they do have active biological targets. We are actively going after things like mTOR and PI3K and all these other kinds of targets. Supplements generally have fewer side effects than drugs do, and natural compounds can have synergistic effects. And so, we're looking at not just really targeted action sometimes, but we're looking at a more global action in that biochemical terrain. I do want to say that supplements do not replace the benefits of a healthy diet and lifestyle. If you're just taking supplements from Costco and you're not doing the diet and lifestyle pieces that do have a lot of robust data behind them, you might as well be kind of, throwing them down the toilet. I mean, they're just not enough. Supplements are just not enough. They certainly can be helpful, but they're just not enough. So a couple supplements that I wanted to bring up. These are probably the most popular, but they also have the best data and are the most ubiquitous. Curcumin, fish oil, and vitamin D. And I just put a couple others up there because those come up sometimes. But curcumin is sort of the darling of naturopathic oncology. Curcumin is the spice from the ginger family, otherwise known as turmeric. It is a powerful anti-inflammatory. These are all of curcumin's targets. You'll see here, it's an mTOR inhibitor. It enhances P53, which has to do with DNA repair. Here's NF-kappa B. That's a powerful inflammatory chemicals. Here's COX-2. Here's LOX. Again, those are inflammation producers. So curcumin actually works in all of these different places. It's a pretty powerful plant, and it does have a fair amount of research on it. So it can have anti-tumor effect in its anti-inflammatory and pro-apoptotic actions. It's also been shown to inhibit cell proliferation and decrease the likelihood of blood vessels being grown at a tumor site. It inhibits, like I said, a whole bunch of different chemical pathways in the tumor progression kind of cycle. It definitely regulates NF-kappa B gene products, COX-2, other inflammatory products, and interestingly, also curcumin has been found to radiosensitize cancer cells to radiation, but radioprotect normal cells. I find that my patients who take curcumin during radiation end up with pretty decent skin afterwards. And the radiation also seems to be effective. So I think there's, obviously we need more research on curcumin, but I think it shows a lot of promise. There are a couple studies here. And one thing I wanted to mention about references is that Dr. Sweet, my colleague, has put together an enormous list of references which we're going to post on our website. I decided not to take up a whole bunch of space on the slides with them, but they will be on our website by the end of the month. So you can check out redcedarwellness.com if you want all these references for natural products and interventions. Quick note, curcumin, you can eat curcumin in your food, but generally it needs to be bioavailable, and it's best taken when it's combined with something called bioperin, which is a product of black pepper. And many of the products you find out there now are good combinations, and they're more absorbable. Vitamin D, most people know about vitamin D. Now I'm finding it's hard for people to get their vitamin D measured and have insurance cover that test. So generally, most people need to be on vitamin D. Vitamin D is an incredibly important vitamin for bones, for teeth, for lipid metabolism, and it helps with cell differentiation, which is important regarding cancer development. It actually acts more like a steroid hormone than a vitamin. And it's fat soluble. So if you can't remember to take something every day, you can take it once a week and it'll still be in your system. Essential fatty acids are the other really powerful anti-inflammatory to have on board. Omega-3 fatty acids, EPA and DHA, those are the predominant fats that are the most important. That's what you would get in a well-produced fish oil. If you have questions about fish oil, I'm happy to answer those later. They're essential fatty acids because the body doesn't manufacture them. So you either have to eat a lot of fish or you have to take them in a supplement. And essential fatty acids have been shown to definitely decrease inflammation, but also increase cell flexibility, nerve communications. They're mood enhancers and can also enhance brain function. And that's just a diagram about what's important, so I'm just going to skip over that. The sources generally are going to be supplements or fish for the most part. Some concerns though, some fish oils can contain heavy metals. I always want my patients to be taking the purest, if they are going to take supplements, take the purest supplements that they can possibly get. And fish oil is one of those where it really does need to be pure. Different things can impact the absorption of essential fatty acids. Alcohol consumption, again, some prescription drugs, and again, this is where I can really get personalized with individual patients based on what they're doing for other aspects of their health. I'm gonna just, well, here we go, I'm gonna do one. Antioxidants and bioflavonoids, this is a whole nother talk of its own, but as a category, antioxidants and bioflavonoids, which come from, in some respects from these sources, vitamin C, vitamin E, selenium, do have some anti-inflammatory properties, and they also enhance immune function in various ways, like scavenging free radicals. They're antiviral, antibacterial, help with your vessels and your vision. Antioxidants and bioflavonoids, I like to see people get those from food as opposed to taking a whole lot of supplements. And certainly some of these supplements can be problematic if you are going through chemotherapy. So again, there needs to be a lot of caution with anything that you might be taking supplementally if you are doing some kind of conventional treatment. Just a quick mention, boswellia, SAMe, resveratrol, ginger. There's good data behind these, but unfortunately I don't have a whole lot of time to talk to them about talk about them as anti-inflammatories. I've got a couple books and a couple movies here just about inflammation, nutrition, anti-inflammatory diets. I thought the slides were maybe going to be available to people at some point.
After the
Okay,
yeah.
and all the references, I can make sure that Linda has the references from our work, but also they'll be on our website. In summary, inflammation can be a unifying theory of disease. It is influential in cancer promotion and progression. Heart disease, joint disease, and diabetes as well, which a lot of folks have in addition to their cancer diagnosis. And that dietary choices and lifestyle measures can diminish inflammation and control disease.